People are often embarrassed to even talk about this condition, even though every second person has hemorrhoids. Sometimes people don't see a doctor for years. Meanwhile, the disease keeps progressing, even though treatment is much easier in the early stages, and in many cases, it can be prevented altogether. And in this video, I'll tell you how to avoid hemorrhoids and what to do if you already have them. If you sit on the toilet for a long time, even if you're just scrolling on your phone or watching videos, your risk of hemorrhoids increases threefold. And if you're also prone to constipation and need to strain hard every time you have a bowel movement, your risk of hemorrhoids is already close to 90%. The first and main sign people usually notice is blood on the toilet paper or bleeding after a bowel movement. The second most common symptom is a feeling of heaviness, a sensation that something is inside, or a feeling of incomplete evacuation after defecation. A person may feel internal swelling or fullness, even though nothing is visibly seen. Another common symptom is itching around the anus, which often becomes worse after a bowel movement. Pain may be present, but it's usually not unbearable and mostly occurs during straining or after defecation. If strong, constant pain develops, this is no longer an early stage of hemorrhoids. Hemorrhoids develop because pressure inside the abdominal cavity increases for various reasons. For example, when you sit for long periods or strain excessively, this pressure compresses the rectal veins, slows blood flow, and causes blood to pool. Over time, the veins become overfilled with blood and lose their normal function. At the same time, the rectum normally contains small protective cushions, which swell when needed, and help close the anal canal. Without these cushions, a person would not be able to control gas or stool, so their presence is essential. However, in hemorrhoidal disease, these cushions overfill with blood, the veins enlarge, swelling develops, and the person feels that something is inside the rectum, along with a sense of pressure. In some cases, these cushions can protrude outward, a condition known as prolapse. During bowel movements, hard stool damages the veins within these cushions, which leads to bleeding, one of the hallmark signs of hemorrhoids. Tissue damage leads to inflammation. Inflammation causes itching and discomfort, which are also typical features of hemorrhoids. As the hemorrhoidal cushion grows over time and begins to protrude outward, at first, it appears only during straining, and then returns back on its own. In more advanced cases, it must be manually pushed back inside. And in severe cases, the prolapse becomes permanent and cannot be reduced manually. This is important to understand because if hemorrhoids are recognized early and treated on time, you can avoid complications and surgery. Because hemorrhoids can largely be prevented, I'll give you 8 key rules that you should always remember. 1. Never strain excessively. If you can't have a bowel movement within 40 seconds, stop. Come back later when you feel a true, strong urge. This single habit alone can reduce hemorrhoid risk by about 50%. 2. Limit toilet time to 3 minutes. No phone. No reading. Sit down. Finish. Stand up and leave. This habit can reduce risk by about 30%. 3. Get enough dietary fiber, at least 30 grams per day, to soften stool. Sources include oats, beans, psyllium. Psyllium supplementation can reduce hemorrhoid symptoms by about 50%. 4. Walk. Don't sit continuously for an hour. Stand up, move around, and aim for at least 40 minutes of walking per day. Leg muscles act as a venous pump, improving pelvic venous drainage. 5. Don't ignore the urge to defecate. Go to the toilet when the urge appears. This can reduce risk by about 25% because stool becomes dry and hard when held, requiring straining later. 6. Use a toilet footstool. Raising your feet slightly creates a more natural position, making bowel movements easier by straightening the anorectal angle. 7. Lose weight if you're overweight. Even losing 5 to 10 kilograms can reduce hemorrhoid risk by about 20% because excess weight increases pelvic pressure. 8. Use stool softeners when needed. Psyllium, 5 to 10 grams once daily, with 300 milliliters of water for 2 weeks. Start with a low dose and drink enough water. Magnesium oxide can be used long-term, 400 milligrams before bedtime. It softens stool gradually over weeks. If faster, short-term relief is needed, magnesium hydroxide is a safe option, but only for a few days. If you follow these rules, your hemorrhoid risk will be reduced by at least half. There are two types of hemorrhoids, internal and external. Internal hemorrhoids develop from swelling and enlargement of the protective cushions inside the rectum. External hemorrhoids form from dilation of veins under the skin around the anus. This form is usually more painful than internal hemorrhoids. Internal hemorrhoids are typically treated with suppositories, while external hemorrhoids are treated with creams. When we talk about medications, topical treatments are used most often. Most commonly, hydrocortisone cream, which reduces itching, burning, and swelling. Hydrocortisone is effective in about 70% of cases and should be used for no more than 7 days because prolonged use may cause skin thinning. Hydrocortisone cream is usually 0.5%, low potency, used for external hemorrhoids, applied directly to the anal skin, not inside the rectum. It's applied after bowel movements, after washing and drying the area, once or twice daily for up to 7 days. Other options include local anesthetics, such as lidocaine, and venoactive medications like diosmin hesperidin, which improve venous tone and reduce swelling and bleeding. Short-term use of suppositories is also common. They may contain corticosteroids, anesthetics, emollients, or combinations. Suppositories are used for internal hemorrhoids. Most commonly, hydrocortisone suppositories, 25 milligrams, once or twice daily for up to 7 days, preferably in the evening after bowel movements. Stronger options, such as prednisolone suppositories, should be used for no more than 5 days, once daily. Combination formulations are also typically limited to 5 days. Among procedures, rubber band ligation is the most common first-line intervention when conservative treatment fails. Sometimes, repeated sessions are needed. If ligation does not work, surgery is performed in complicated cases. In terms of effectiveness, surgery has about 95% success, while a single ligation session is about 52% effective. However, ligation is much simpler and less invasive than surgical excision of hemorrhoids. In summary, treatment follows this path. First, the 8 preventive rules if hemorrhoids are present. The same rules plus conservative treatment, creams and suppositories. If that fails, surgery. Ignoring hemorrhoids and leaving them untreated is not an option because the disease progresses. It can cause bleeding, may lead to ulceration, and external hemorrhoids can cause severe pain and discomfort. Overall, hemorrhoids can significantly reduce quality of life.